So does that make that screen bigger? So the fact.
Geez, like travel for this?
You never know who you're gonna need to
Call to order.
Oh, the
I feel like I was gonna say, I feel like I get in trouble with that, so maybe not.
any intention
No.
on what I've said. He is unfazed.
Ingrid, even Dan McGuire got here before you did.
Yeah, well,
I'm
okay.
gonna mark it on the calendar, Mr. McGuire.
In my defense, you weren't here yet last time and I was, so. Numbers, how are your iPads? Find everything on them okay? Yeah, they're updating for you? I have been having issues, but it seems to be better.
It's not made there yet.
Maybe, I think we have a quorum, right? Who are we missing? Just Dr. Barrett? Oh, and Francis.
Cindy Francis might be.
Dr. Harris.
Oh, Dr. Barrett is online. Okay, perfect. Alrighty, and then we'll call this meeting of the Community and Health Services Standing Committee to order. Miranda, can you do roll call, please?
Yes. Miller. Here. Brewer.
Here.
Kramer. Here. Glassberger.
Here.
Harwick. Here. McGuire.
Here.
Bears.
Here.
Braithwaite. Checker.
Here.
And Cherry Becky.
Okay, thank you. And the meeting was properly posted?
Yes, ma'am.
Okay. Any changes or corrections to the minutes from last meeting? Alrighty, then we'll say that those are approved and go to public comment. Do we have anyone here from the public who wishes to speak?
Can I be a public?
Sure.
For just a few minutes?
Of course.
We have visited 2 nursing homes with the mini doctors. We come to our house. And just this Monday or Tuesday it was, we went to Schmidt-Wood Hills. Some of the people are the same, but there's a lot of new people that have since come into the homes to capacity way of people. We got to our house and they already were outside lined up, ready to go. And usually we're there first, but they were ready. And then we got to Schmidt-Woodland Hills, same thing. We go up to the top part first, we go in the back, and we go to the nursing. Jump down to where they people last, and it was hot, but we had a good time. We had apples and carrots, and everybody except one person, she's a little afraid, which is fine. Pet them, and And so the next visit is Wednesday of next week. We will be at Marcus Guest Home.
Okay.
And then the following week, I believe it's the 19th, we will be in Pine Valley. Then the 20th, we go to Reedsburg Healthcare Center, Swan County. So, yeah, we have a great time. You should come out.
How many donkeys do you have?
2.
What time do you do that at?
10 o'clock.
I've seen pictures. The donkeys are adorable. I didn't know you visited that many different
Yes.
nursing homes, so
And
that's
last year, we were also invited to go down to Lone Rock for the children's reading hour at the library, and
ooh,
kids had a ball.
should do that here. Huh. Well, that's wonderful. Thank you.
You're welcome.
Anyone else? Okay, we'll move to number 7, reports, which starts with the HHS director.
So in your package, you will see the June HHS updates, just a couple of things that I want to highlight. We continue to not have a mental health therapist. We've interviewed a couple people, haven't found a match yet. And so we have started exploring the option of contracting with a mental health therapist. So most likely, if we don't have any other luck between now and next month, you will see a contract from an agency to start contracting that service. We do have one open position in our child and youth services. And so we are in the process of hiring somebody there. We did interviews last week, and hopefully by the end of this week, we will have an offer made. And then in our public health unit, we had our public health specialist start on May 20th. Stephen Moss is his name. On May 29th, we had the CHIP kickoff event for our community health improvement plan, and there were 14 individuals that came to the meeting. Next month, we will provide an update to you on the CHIP, the progress, the plan, so that you guys are aware of that. And then did also want to note that the number of TB skin tests that had been given in April were higher than the months of January, February, and March combined. So the health department's been very busy with this TB skin testing. And then this month is Employee Wellness Month, and so we have some activities throughout the month for our employees to support their wellness. We are doing a building cleanup day on Monday. There's just a lot of stuff in our building that haven't been touched in the almost 2 years that I've been there, so we're working on cleaning that out. And then we did complete the Leadership Academy through Southwest Tech. It was very good, very beneficial, and the next steps that we're going to have is when I meet with the managers one-on-one, we're really going to talk about how are we going to implement what we learned. And then the last thing, we completed the space needs analysis, and I have a meeting on Friday to meet with Venture and talk about next steps. So there are updates. Any questions on any?
But
Yeah.
is TB on the rise, or is it just a requirement that you need to do?
So it is a requirement for assisted living facilities, nursing homes. It does appear, and correct me if I'm wrong in regards to this, that the agencies are just trying to get everything up to date.
That's correct. The reason for the increased number of testing was to help those facilities get their employees onboarded.
Thank you.
Any other questions? Okay, thank you. The ARPA utilization.
Yeah, so last month, we brought up, that, we were gonna be, we had this funding to use for certain, certain expenses, and it was asked that we kind of give you guys kind of a summary of kind of the spending plan, because it's $353,600 available for use. We have to use it by the end of the year. And so what we're sharing is the plan that we actually submitted to the state, letting them know how we were going to do that. So so far we haven't spent a lot of it. That's what's in red is what we've actually bills we've already paid. And since we got this, we've ordered the refrigerator, pharmaceutical grade refrigerator. So I'll be updating that throughout. And we've shared some of these numbers with Candace and the MIS department on what's available to use for, like, if we do the 365 upgrade or get the finance software. So yeah, so that's kind of it. Does anybody have any questions about anything? It's just, and we're not tied to this. If there's any, like, if we need to move the money around or anything. It's not like a solid budget. It was just, they wanted to know how you can spend the money. So that's really what it was.
Madam Chair, it would seem that we would be hard pressed to spend 300, whatever the remains of the 353,000, so.
I think two of the really big expenses that are gonna help to spend all this is the finance software and the 365 upgrade. I think those are gonna be pretty pricey activities for us, for the county, and so I think we'll be able to spend all those with those two projects.
So we would get it down to 37,000 apparently, right? That's like-
Yeah, that's what we have remaining, but we also know that there's more that could go to finance software and more that could go to the 365 rollout.
If I may, Madam
Yes.
Chair.
Yes.
So yes, the Tyler software implementation will be roughly about the initial implementation, somewhere around $260,000, and then it will be $119,000 annually. And so what our agreement with them is, we were intending to pay the 3-year contract in full to spend down some of these ARPA dollars, as well as the ARPA dollars that the county as a whole has. And this will not just be finance software. It will actually be finance, HR, payroll, document management, and a few more things. And it's an all-in-one system. So it's really outstanding. And we really appreciate the fact that HHS is willing to, kick some money in towards that cost. It really is a very big piece of infrastructure, which is what ARPA dollars were set to do. In this way, God forbid we ever have another pandemic, everything we need to do can be done remotely. So
So the two that are budgeted for that you don't have over on the right side, like the tapper machine and the blood pressure machine, are those ones that you're still planning on putting in there?
So those are ones that Brandy and I just have to talk more about and work on getting ordered. I think we have 2 pepper machines requested. I don't know if we will need 2. It might just be that we need 1. So those are things that we're still talking about and working on getting quotes for.
And this is really a working document, so as of the time I sent this is, some of these numbers have changed, like for example, the network switches. We ended up with we're gonna get a discount, so that won't be the 48,000, so.
Great. I don't think there was any motion or anything we needed to make on this, correct?
Correct. How often do you want us to be bringing this back to this committee?
Committee, do you guys have thoughts? I mean, I guess I don't know how often this is changing or would need.
Madam Chairman, I would think that quarterly at the
Yeah.
most would be good.
So like 3 months from now.
Yeah, that would be very reasonable. I think you'll have spent some
Mhm.
and have updated figures on others, but
Sounds good to me. Okay, 7C, DHS 140 rebid. Is that Brandy?
That is great.
Congratulations again.
Thank you.
Wonderful achievement.
Good morning. I'm Brandy Anderson. I'm the Richland County Health Officer and Public Health Manager, Public Health Nurse. And I'm here to do a brief overview of the results of our 140 review and just a really quick explanation of what that is and how that process looks. And I just want to say that I'm very pleased, grateful, relieved that we did have a successful 140 review. And we had received from State Health Officer Paula Tran our letter of determination that indicates that we can continue to operate as a level 2 health department. So you have in your packets, I believe, the final 140 review report, which looks like this. And so just really briefly how that comes about is that all local health departments in the state of Wisconsin need to participate in this review every 5 years. It's a statutory requirement. It's labeled 140 because it is because of Wisconsin Administrative Code 140. So our health department coordinates with a 140 review team from DHS. Specifically, that was a woman named Sharon Beck. and then Joe Larson, who are our Southern Region representatives with the Office of Policy and Practice Alignment. And they were very helpful and communicated with us often throughout this process as we were getting prepared to do this. So we, as a local health department, we collected information and submitted specific documentation that we need to complete the review. A few of those things are an annual report and making sure that we've done annual reports to make sure that our health committee, our board of health has been meeting annually, and to make sure we've done a community health assessment and a community health improvement plan. So then an on-site visit was scheduled and conducted, and we did this review in person in March. They came to our health department, some representatives from the state, and then along with Ingrid and Cindy, who were there as representation for the board, as well as my public health staff. Our agency director, Tricia, was there, and then our previous environmental health coordinator, Troy Morris, who did provide services for Richland County for, I think, 21 years, we figured. And he was able to speak to those most recent services. So after that process was completed, that afternoon of question and answers, the review team provided us with their recommendations with a follow-up report, and which is now the document that was generated. And then that goes to State Officer Paula Tran, and the health officer did provide us with that certificate of designation. And just the reason this is done is 140 reviews. I'll read this here from the state. It says it provides motivation to review policies and procedures, reorganize resource materials, and update agreements. And it's also an opportunity for staff and board members to learn from each other about the function and successes of the local health department. And as far as quality improvement, DHS 140 reviews identifies areas of opportunity and helps support local health departments seeking accreditation. It improves the quality and services provided and ensures a strong public health system. It was emphasized throughout the process that this was not a punitive type of review. It was very much coming from the standpoint of how can they support us and help us. So I'd like to highlight very briefly some of the successes and areas of opportunity within the document. That document is quite large, and I just want to say that a few things here is that it was apparent that the staff was enthusiastic and supported in their new roles. We did have a couple of new staff present during this review. We were all new to the process. They were supported in their roles through training opportunities, networking, and support of the health officer, HHS director, and board of health. So that's a strength that was highlighted. Another thing that was highlighted was our community partnerships. And then some areas of opportunity that I want to talk about are quickly that we don't have a formal QI plan in place for our local health department, and that was something that we recognized and that was also highlighted that we could work on over the next 5 years. And that environmental health services are an area of opportunity. As I mentioned, Troy Morris used to provide those services. Since his departure, we have provided those services ourselves. And we did just hire a person who has former registered sanitarian experience. So his knowledge will be helpful as far as getting going on our environmental health cases. And then it just also highlighted that public health nursing service is an opportunity for RCHHS to enhance the level of services provided to the community, as well as strengthening the operational capacity of the department. I think I hit most of the highlights on that 140 review. Again, I'm very pleased with the outcome of that. And if you have any questions, you're welcome. I would take those.
It was an interesting process, if I might add.
Thank you, Brandy. Does anyone have any questions? They put a lot of, Brandy and her staff put a lot of work and time into this, which was very evident at the review itself. So I just want to give them kudos and appreciation for all their hard work. This was a lot. Thank you. Okay, 7D, the 2023 Health and Human Services Annual Report.
So that was also in your packet. What I'm planning to do is really have each of the managers talk about the highlights from their unit. We can kind of go down the path, and if we want to start with Amanda to discuss services.
Sure. I won't, in the report, it's bulleted, it's page 8. It's my section, but, thanks, Brenda. The bullets, I'm not gonna read through all of them. It's just basically our daily tasks that we do. And a great team that we have. The biggest thing in 2023 was we used to have an administrative and building operations manager. She resigned, and then we made the decision not to fill the position. So we kind of became, instead of 2 units, we're now 1 unit. And we call ourselves the administrative and financial services unit now. Because a lot of the duties that they do, they cover for each other, they help each other out. Some of our biggest achievements in 2023, we really, in 22, we had really started to use DocuSign, but 23 was the year where we like really started to use DocuSign. It was huge, especially when it comes to our contracts. It definitely saved on the paper and postage and turnaround and everything. Great responses using DocuSign from a lot of our providers. EHR, our electronic health record system, again, we added a module called the Engage module. And now what that allows us to do is we can do reminder calls and automatically, reminder text automatically, people for their appointments. We can actually send out intake paperwork ahead of time via email that they can fill out and submit if they ever. So that's really saved a lot of time on the front end and getting people in. We continue to provide HR functions, human resources functions through 23. Revenues, again, staff just they're diligent in maximizing revenues. I always chuckle about my billers. They're persistent. There's a quote out there, persistent billers are the best billers. They're always great about trying to get that revenue coming in. Wimker was a successful year. We had a good reimbursement there. We had a positive revenue adjustment there. Billing, again, like I said, great in the billing department as far as revenues. Wimker is, sure, I can explain that better. I think last month it was acronyms was something that was brought up, and Trish did put an acronym cheat sheet out in the folder, but WIMCR is a Wisconsin Medicaid cost reporting. It's not in this actual meeting, it's in the actual folder, so you see it out there. Yes.
So you guys can all find that.
So she just gonna leave it out in the committee folder we figured versus it getting asked in an actual meeting.
Great.
So that's out there, but WIMCR, Wisconsin Medicaid Cost Reporting. So the programs, there are programs that we provide, like our CCS program, the community, what's CCS? Comprehensive. I don't even know what I'm
You're making us feel better.
Yeah. So there's that, and then our behavioral health clinic, any of our outpatient mental health, our crisis billing, those kinds of things when we bill Medicaid. They pay us what's called an interim rate. And then we do this cost reporting at the end of the year, every year, to get reimbursement for maybe any additional expenses we might have had above and beyond that interim rate. Especially like the CCS program, we can get 100% reimbursement for all of our costs, not just the staff time for CCS. The actual case managers, service facilitators, we can get reimbursed for some of my time and Trish's time and things like that, which aren't included in the interim rate. So WIMCR is a huge part of getting the county reimbursed for those providing the services. Let's see. So that's really this, what we do every day is reviewed there. And then I did include our 2023 financial summary. You'll notice it looks very, very similar to the monthly report that I do here. I was like, why am I recreating something in a completely different format when I have all of this information that I provided, earlier in the year. So, so this is this shows you that what our budget was for 2023. Where our actual expenses came in, that's page 10, and then page 11, kind of plug in all the different revenue sources, how much of our budget was tax levy, what Medicare, Medicaid, WIMCR, those kinds of reimbursements. We did get a little bit of ARPA funding reimbursement for some programs. And then we have our state-based county allocations and all of our state category of programs that we get reimbursed for. So we kind of, I'm showing this core balance of the end of the year, $326,631. Now, understand all of this is not audited. So this is just based on my reporting. And then I also just did a screenshot of where the placements landed, Fund 44 and Fund 54. So, and then this is something that's been in previous annual reports. Just kind of where some of our service contracts landed. These are all our contracts over $10,000. One thing I don't have in here that I could probably share is like, when I talk about the CCS program, if you see, or which one, let me see, Driftless. If you look at Driftless, counseling LLC, 808,000, that didn't cost the county 808,000. Okay, they're a service, CCS service provider, so that's reimbursed. But we have to have a contract in order to work with them. Okay.
Thank you. Do you guys have questions? I think you probably explained this, or maybe it's obvious, but now I lost my place. Hold on. On the budget, where it says what we budgeted and then what our actual expenses were, it's bigger difference than that 326,000 that you have as the end of your budget balance. So I'm just wondering, I'm not a finance person.
So, right, so we budgeted that 8.7 million, our expenses were 7.2 million. And we received 7.5 million in various reimbursements, so. That's where this, is that what, I don't know, I'm asking.
Maybe I'm just
I
not.
think, are you asking the difference, like the actual budget versus our proposed budget or our actual?
And that's
funds?
different than what she's saying is the end of the year.
Correct, yes, yeah, our budget, the budget doesn't change, the budget stays the same, it's just all of that other stuff is. So at the beginning of the year, this is what we think we're gonna need to cover all of our expenses.
Okay, I see
And
it
at the
now.
end of the year, we,
You got the.
yeah, right, yeah,
Okay.
the actual.
So was a lot of that difference, because that's over, well, almost over $1 million. No, it is.
I see what you're saying, yeah,
Difference.
1.5 million less.
Yeah, is that due to like staffing or was there just different?
Some of it,
Yeah.
right, so like, for example, not filling that position, that administrative and building, I mean, right, there's probably about 80 to 100,000 right there, not filling that.
I think public health's a unit of
Public
one,
health
the
was a unit
majority
of
of
one.
one.
Right.
And you could look at the different, some of the, like our CPS contracted services, that was low. Even CCS was low, but that's just varies depending on the services. It's some services that were.
EODA outpatient, we did have the outpatient EODA therapist for a lot of last year, so they're from those expenses.
Yeah,
So
but
really,
there's almost 150,000 there.
it really does go to.
That's kind of what I figured. You know, we had a lot of open positions too.
Yeah, and I think I did the math the other day, and normally our budget, about at least 50% of it is staffing and fringe, so if you don't, not filling positions, it's gonna have a huge impact.
But your revenues look outstanding.
With
Your
that.
revenues look outstanding.
Yeah, the one thing we do is, I don't necessarily budget 100% of Whimper, because that's such a odd number that you just can't guess what that's gonna be, right? It's a formula based, and so that kind of is where I think sometimes our revenue's a little bit better than we anticipated, because that number would get reimbursed more or things like that, so. Not too much of, sometimes we get some late revenue too, right? Like it would have been maybe 2022. And it's still in 23 because it maybe comes in after the audit's done and all the journal entries are done. So then it just kind of sits in this year, so that might be in there. But yeah, I like the positive revenue.
Oh, definitely.
Sure.
Well, and with the placement expenses, I know we don't have a ton of control over that, but it's nice when it comes in under budget.
Yeah.
A good year.
So our behavioral health unit is made up of 9 different programs that offer a continuum of services to Richland County residents from birth throughout the entire lifespan. Some services we offer are case management, medication management, mental health therapy, crisis, adult protective services, and a few others. So I thought I'd just go and kind of highlight some of the programs and what some of our numbers are. So treatment court is an alternative to incarceration program for nonviolent adults who are involved in the criminal justice system as a result of their substance abuse or mental health disorders. In Richland County, we have 2 different treatment courts. We have sobriety court for those whose offenses were alcohol related and drug court whose offenses were substance abuse related. And in 2023, Richland County served 60 consumers in that program. Then we have our outpatient clinic where we provide mental health and substance abuse services. We offer mental health therapy, substance abuse counseling, medication management, psychological assessments, and psychiatric care. Our clinic is staffed by 2 therapists, a substance abuse counselor, a psychiatric nurse practitioner, a psychologist, and our psychiatrist. In our outpatient clinic, we also conduct intoxicated driver assessments for those convicted of driving under the influence, and Choices, which is an educational program for individuals that were charged with underage drinking. In 2023, we completed 94 intoxicated driver assessments, 82 mental health assessments, 27 substance abuse assessments, and 94 psychiatric assessments, and we had 13 youth Choices programming. Then we have crisis. Our crisis services are set up to help individuals experiencing distress with their mental health. Behavioral health provides walk-in crisis services and mobile responses during normal business hours. And then we also contract with Northwest Connections, and they do telephone assessments and mobile responses after hours. Under crisis, we also have our emergency detentions, and that's when an individual is taken into custody after it's been determined that they pose an imminent risk to themselves and or others. In 2023, Northwest Connections had 367 crisis contacts, and Richland County crisis staff had 1,183 crisis contacts. So that brings us to 1,550 crisis contacts in Richland County. And then we also had 21 people emergency detained in 2023. Our adult protective services unit is the next program. Our APS worker assists elderly adults and adults at risk who have been or suspected to have been abused, neglected, or financially exploited. And in 2023, there were 118 APS referrals. Then we have comprehensive community services, our CCS. That is a Medicaid program that helps individuals of all ages with mental health and substance use disorders. The goal is to keep them as independent as possible within the community by providing intensive outpatient and substance abuse services. We have in-house service facilitators that coordinate this for individuals, and then we also contract with Trailhead for some of their service facilitation. And in 2023, 47 consumers were served within CCS. And then I just want to add that CCS is probably our fastest growing program within our unit. In the last 2 months, we've got like 30 referrals. Wow, it's growing. And then within our CCS program, that's also where we provide a lot of mental health residential services. So those are individuals who require more intense services and are unable to be successful in the community. So they're placed in an adult family home or a CBRF just to provide them more support. And in 2023, we had 11 consumers placed in a group home. Then we offer children's long-term support, and that helps children with disabilities and their families through supports and different services to help the child live their best life at home and within the community. In 2023, we had 78 people served in CLTS. Then we have Birth to 3. That's an early intervention special education program that helps children from birth to age 3 who have delays or disabilities. And in 2023, we had 61 children served in that program. And finally, we have Coordinated Services Team, or CST, and that's a program for youth who are involved in multiple systems of care. This could be like therapy, youth justice, child welfare, special education. And in 2023, we had 3 children who were served in that program. 2023 was a good year for the behavioral health unit. For the first time since, I think before COVID, we were fully staffed for a period of time, so it's really exciting. Our programs are really growing. Like I said, CCS is really growing. And right now, the only thing we're missing is one therapist, otherwise we'll be back up and running full again.
Thank you. That was a great report.
Thank you.
Any questions or comments? Thank you. You guys do a lot of work. Okay, we have next. Ives.
Good morning. I'm Roxanne. I am the manager for the ADRC. Our local ADRC is actually part of a 3-county region. It's the ADRC of Eagle Country, which serves Richland County, Juneau County, and also Crawford County. Our services, we serve individuals who are elderly, people that have physical or developmental disabilities, individuals that have substance abuse issues, mental health issues, and youth that are transitioning from children's services into the adult world. We also have family caregiver programs. So we always tell people, if you're not our consumer today, you may be tomorrow. So we work with the entire community. We never turn anybody away. So we have numerous different programs that I'll go through, but one number just to let you kind of let soak in is last year we had contacts, 14,939 contacts. So we really are enmeshed in our community. People know who we are, where we are, and they know that if they're needing something, they can come to us. So the first section, so we do information, referral, assistance, and options counseling. So that is done by our ADRC specialists. They meet with individuals as they come in and find out what their needs are and what, do they need just a quick resource to help them with something? Do they need referrals to other programs? And they're also the starting point for long-term support programs. So they do the assessments for individuals to be, to get into like family care programs. And they also assist people with doing their Medicaid applications through that process. So last year, we actually served over 4,000 people. They had over 4,000 contacts just for those 3 staff. And actually we had a retirement last year. So for part of last year, it was only 2 staff. As I said, publicly funded long-term care programs were the starting point for that. So we do the long-term care functional screen. We work with the economic support unit very closely to assist people with their Medicaid, and then do enrollment counseling and enrollment into those programs. So in 2023, our staff did 89 functional screens and they enrolled 77 people into long-term support programs. Our disability benefits specialist works with individuals that are 18 to 59. They assist them with applying for disability, can assist them with appeals and other types of programs as well. In 2023, our disability benefits specialist program assisted 131 Richland County residents, and that helped them to receive over $658,000, $658,000 in federal, state, and private benefits. And so what that means when we talk about monetary impact, that amount of money is what they're bringing back into the county. So if we look at the cost of one of our specialists and the amount of money that brings into the community and to our residents, it's a very large impact. I also wanted to highlight too, since the disability benefit specialist program started in 2002, there's been a monetary impact to the county of over $17 million. Our elder benefit specialist, so we have an elder benefit specialist that works with individuals that are 60 and older. They can help with applying for disability, Social Security, help them with their Medicare open enrollment every year, and numerous other types of programs. For our elder benefit specialist, that one we usually see a little bit higher impact, monetary impact. And so in 2023, for our elder benefit specialist program, we saw over $1.6 million in monetary impact coming back into the community. And they served 341 residents. They do a lot of outreach. They're out in the community a lot. We do Medicare presentations every month. They go out to the meal sites and are really out getting information out about helping people get enrolled into their Medicare programs and so forth. We also in the ADRC have
prevention services and early interventions. So we partner with Simon's Recreation for this. I can't highlight enough that we really couldn't do what we do with the amount of money that we get if we didn't partner with Simon's. We get just over $2,000 from the state or from our Older Americans Act. And we do a lot of programs. We offer Tai Chi, we have Strong Bodies. We also have Walk with Ease. And now we actually this year started Bingo Size too. But last year, a total of 35 seniors participated in different classes. So when we think about that partnership, it helps Simon's Recreation, but it really provides a huge service to our community. They provide services here in Richland Center, Viola area, Muscadet. So we're really hitting people across the community with just a small piece of money. We also offer transition services for youth. So we start working with kids when they're between 16 and 17 years old. And that is to do a youth in transition. That's helping them transition into adult services. And so through that process, we go to IEP meetings. So that's their meetings at the high schools that they're having with the special education programs. We work with families to be able to get them onto long-term care programs, and then our disability benefit specialist also helps them to be able to get adult benefits for Social Security and so forth. We also offer Alzheimer's family caregiver support funding. So that actually can assist individuals with services in their homes, also some trainings for them and some outreach as well, just to bring more awareness to Alzheimer's disease and different types of dementia. So in 2023, we received $5,532 to be able to provide different services to individuals in our community. We also, through our regional office, we have a dementia care specialist, and she actually splits her time between Richland County and Crawford County. And what she does is she meets with families and individuals. So she does individual consultations so that people can not only learn more about the disease process, but also learn tools to be able to manage that disease. She also offers a lot of outreach. So she did Dementia Live last year for us numerous times. We provided Dementia Live to our local HHS staff. We went to local banks, our local EMS, our Sheriff's Department, our Richland Center Police Department, and some individual families. We have numerous staff that are trained in providing that program. So when we are able to go, we do numerous sessions for people in the community. Our transportation program, we've always had a very robust transportation program. So we offer both driver escorts. So that is taking individuals to their appointments. And we have between 20 and 25 drivers at a time. So last year we provided over 4,000 one-way trips. So that is actually getting back to pre-COVID numbers. So we had seen it really drop off during COVID years, but we are getting back to our pre-COVID numbers. And so they traveled 154,986 miles. So our volunteers are very, very dedicated. They spent 5,488 hours of their time providing trips. And then we also have our bus program as well for wheelchair transportation. And also we do bus routes going out to different communities. And so last year we provided 1,498 different bus trips. We also have our National Family Caregiver Support Program. So that program is meant to support caregivers in our community. And so that way they have the tools and they have the support to be able to continue caregiving. Really is meant to help people stay in their homes longer and provide that support, which then keeps people out of facilities as well. So last year, we actually provided $12,636 to be able to provide information to caregivers, assistance in gaining access to support services, individual counseling, respite care, and supplemental services. So in 2023, we assisted 33 local families. So that just continues to grow every year. Unfortunately, our ARPA dollars will be gone this year, so then we're going to have to shrink back down. So next year, you're going to probably see a decrease just because the amount of funding that we're losing. And then our final program, and probably one of our biggest programs, is our senior nutrition programs. So in May of 2023, the senior nutrition program moved from public health to the ADRC. So that was a big change. but it's been going very well. So we have 3 meal sites across the county. We have Richland Center Meal Site, which also, that one is 5 days a week. We then have our Casanova site that is 1 day a week on Wednesdays, and Rockbridge is 3 days. We do offer home delivered meals from our Richland Center site and also from our Casanova site as well. We also last year, I think our biggest thing last year was we went through the process to change vendors for providing our meals. That has gone very well. Participants, we've actually had participants coming back. They really enjoy the meals. And there've been really very few complaints. So that has been a really great transition. We also provide the senior farmers market voucher program as well. So last year we provided 196 sets of vouchers is what we were given, and we actually provided 189 out to individuals within our community. So those vouchers are for individuals who are low income. Last year they had increased it to $35 per person, and it is for individuals over 60, and they do have to meet different requirements as well. So I think that's about it. As a brief one, I mean, you guys can read all of the nuts and bolts, but so any questions?
Thank you, Roxanne. Yeah, Michelle?
Who's preparing the meals for the senior nutrition program? Is it staff?
No, so we have Mazo Catering out of Mazamani. So it used to be provided out of the campus kitchen. And then last year we switched to Mazo Catering. So they actually bring the food bulk to the Richland Center meal site, to the Casanova site. And then we have staff that that dispenses that out.
That does the deliveries and then goes to the Rockbridge site?
Right.
So in the middle of your report there, you mentioned you providing services in Muscatine. But of course, Muscatine is in Grant County, so I have to ask that question. Did you mean Orion or did you actually mean Muscatine?
So we actually, for our partnership with Simon's Recreation, we do actually hold like Tai Chi and our Strong Bodies classes in Muscatine. However, we partner with different counties as well. So when Simon's goes to Muscatine, they bill Grant County for their participants, they bill Iowa County for theirs, and they bill us for our participants. So it gets those people from Orion, so they don't have to come all the way into Richland Center. They can just go across the bridge and, yeah.
Okay, thank you.
Yeah, great question.
Anyone else? Thank you, Roxanne.
You're
Okay.
Wait, it's out of order.
Yeah, that's not alphabetical.
I'm going in the book.
Oh. So I don't add the list, so. Hello, I'm Brianna Turk. I'm the Economic Support Manager for Richland County. Our unit figures eligibility for public assistance benefits. Those would be Badger Care, elderly blind disabled medical assistance, Medicare Savings Program. Those all fall under the Medicaid umbrella. And then there's also Food Share, which is formerly known as food stamps, and childcare. And we also do daycare certification. Apparently scared everyone off because we don't have, I thought I had one on the hook, but I don't think she's interested anymore. So in 2023, the Economic Support Unit saw the end of the COVID public health emergency and the beginning of unwinding. As Tricia mentioned during this meeting last month, during the public health emergency, medical assistants and Badger Care recipients had their benefits frozen. This meant that no one could lose their health care coverage through these programs. The only changes could be increases to their benefit. So along with people already receiving benefits at the time public health emergency started, there were a lot of new people becoming eligible due to them losing their health insurance because their job was lost. So when the public health emergency ended, we had to test all recipients' eligibility, and they gave us 13 months to do that. So that started May 2023 and ends this month. Let's see. So I get, and the name unwinding was given to those 13 months.
So in theory, we'll be back to pre-pandemic normal. We'll see what that actually turns into, since nothing is pre-pandemic normal anymore. I do know that we look forward to not having to follow two sets of rules, because right now we are following rules for folks that haven't had their renewal yet, so they're still in the pandemic rules. But new applicants and people who have had their renewal so far in the last 12 months, they have to follow the old set of rules. So workers will appreciate only having one set of rules and policies to follow. Let's see. We had a lot of successes in 2023. We became fully staffed. Also, the goal for Richland County Economic Support is to handle 8.9% of phone calls for the consortium. Our team exceeded that by handling 9.4% of the phone calls. We also handled 9.1% of the non-phone casework for the consortium. This is very good considering that we had two vacancies for part of the year, and then they were new workers for the rest of the year. Another positive is that economic support specialists have 30 days to process an application. The state has set the benchmark for that at 95%. So what that means is that 95% of all applications must be processed within 30 days. So the consortium beat that by having a timeliness rate of 98.18%. Locally, our workers did slightly better of 98.74%, and I consider that a win for our local team. And Richland County Economic Support Specialists work very hard to correctly determine eligibility for benefits for the residents of the 8 counties in the consortium. They do this professionally with compassion and empathy. We treat the people we serve like we would want our parents, children, or other loved ones treated. And I'm very proud of and thankful for our local economic support team. Any questions? I didn't read word for word in the report, so if you have questions about that.
Can you explain the consortium? You used the word consortium
Yes,
several times. Can you explain that, please?
Yes, the consortium is made up of 8 counties and we are in the capital consortium. And that's Adams, even after so many years, I have to think. Adams, Columbia, Dane, Dodge, Juneau, us, Sauk, Sheboygan. So our workers talk to any resident of those 8 counties and help and determine eligibility for their benefits. Except for childcare. Childcare has to be done in the county of residence.
And we're reimbursed for that county-wide.
Yeah.
We don't do it because we like those other counties.
Right. Correct.
Well, we may like them, but
Oh, they're okay. Not as good as
I think about 15 years ago, the state system changed. So instead of counties handling it individually, the state required counties to work in consortiums, and that's when that began. So it was kind of pooling the funds and the resources. And we have a maintenance of effort of 156,000 that we have to contribute. The rest is covered by the consortium.
Thank you.
Any questions? Oh, sorry. Thank you for the report, Brianna.
Okay.
Great, Child and Youth Services Unit. Hello.
Okay, I'm Kayla Williams. I'm the new Child and Youth Services Manager over at Health and Human Services. Within our unit, we have 8 total staff. So we have the manager, we have a supervisor, we have 4 case manager positions. One of them currently is open. We have a youth aid worker and a family preservation worker. The 4 programs that we do within our unit is Child Protective Services, Youth Justice, Foster Care and Kinship, and Independent Living. So in 2023, the CPS reports received, we received 275 reports. There was 436 alleged victims. We opened up 61 initial assessments, meaning that we went out on an investigation because it rose to the level that we would open it. Child welfare reports,
So those, if we feel like we kind of need to touch base with the family, see if they need any more help. So it's kind of that lower level intervention, but we still offer, community services, something like that, some local programs. So we received 79 child welfare reports and we opened 52 of them. And then I believe we ended 2023 with 19 kids in at-home placement. So youth justice, so our juvenile justice, we work with children 17 years of age or younger who have gotten in trouble within the community, violated laws, been charged for something. So in 2023, there were 25 youth justice referrals. 7 cases ended up with supervision and services, and there was 4 cases that were pending in the court process at the end of the year. So what we do with them is we usually open up like a 1-year case with them, depending on what charges they received, what the judge, orders, and then they have to follow conditions, meet conditions. They'll have community service hours that they have to complete. Part of the conditions that we put in place is mentioned lower the YES program. So they have to participate in that. And then depending on what they got in trouble for is kind of the basis for what we put their conditions as. Okay, and then the youth empowerment services, so our YES program, our youth aid worker, Eric Ives, runs this program. It's a summer program. Last year, it was ran on Tuesdays and Thursdays from 10 to 12. We do offer transportation for those youth to get there and then back home, just to help alleviate that barrier for kids to be able to participate. I think last year there was 6 kids that participated in the program, and they just do different things every day. It's a different topic, a different thing that they're learning. They focus a lot on like money management, so they try and learn some of those things that will help them as an adult. And then lastly, we have foster care kinship and subsidized guardianship. So we have, we don't currently have any foster homes open in Richland County through Richland County. We work a lot with some like treatment foster homes, CCR, Family Works, those types of things if we're looking for a foster home. We have a lot of kinship care. So if we get reports where there's concerns in the home, we have to remove the child. A lot of times they will go to a family member, which is our kinship care. And then the family member will keep them, help do family interactions with the parents, that sort of thing. Or if they're not able to return home, then we would look at either guardianship with that family member or a termination of parental rights and then adoption with that family member. And then we also have subsidized guardianship. So what that would be is if we have a child in out-of-home care who's in a foster home, we could look at doing a guardianship with that foster home if the case went to that point. And then they just get like an ongoing payment for that. Okay.
Thank you.
Yep.
Questions?
Yes. How many foster homes are in Richland County?
We don't have any right now.
Not 0.
Yep, that's something that we're going to focus on more heavily this year is trying to get some open, especially level 1 and 2, just to take some of our kids that come in.
There are group homes, so. Located in the county.
Yep, we have 2 group homes through Forward Home for Boys. So they take more of our youth justice kids and they serve, I think 12 to 17 is the age group about that they serve. So we do have 2 of them in the county that we do have some placements at.
Where are they placed?
There's one in Twin Bluffs and then one here in Richland Center.
I'll just wait till everybody's down here.
Sorry.
How do you get your referrals to the youth services unit?
For youth
Pick up
service.
a judge, police department?
So we get the police referrals. So when the police department gets called out, they'll make a referral for the charges and then they send that over to us. So then what we do is we have, it's called the Yazi program. So we put in what the youth is being referred for, and then it kind of tells us what level of involvement we should have with them. If it should be formal, if it could be more informal. And then from there, that's when it goes to the court, and then we type up our report.
Okay, so you get a referral from the police department?
Yep.
And how do the parents figure into that? Are they part of that or are they left out of it?
No, they're involved in it. So they become aware once police are involved. The parents are typically aware, and then we reach out to the parents and then have to speak with the child as well to get that process started. But the parents are very much involved. Yeah, or we try to get them to be.
I think you mentioned there were 19 out-of-home placements last year, is
Yep.
that correct?
Yep.
So if we don't have any foster homes, are these then getting placed out of our county into other?
Some of them are. I don't know exactly what it was last year, but some of them are out of home but with family. So they'll still be in the county, or some are with family outside of the county, but there are some that get placed in foster homes outside of the county as well. Yeah.
Questions? Thank you, Kayla.
Thank you.
Public health. Randy.
You're back again?
Randy Anderson here again on behalf of Public Health Richland County, to highlight some of the parts of our annual report. So per my overview, I just want to emphasize that our public health unit, again, we went through a very difficult 2023, losing that institutional knowledge of our former health officer, Rose Gahoot. And then also our other staff nurse, Carlene, left early in the year. So we were left where we needed to really rely on our Southern region partners and create some MOUs and partnerships, and leaned on a lot of help to kind of meet those minimal services for a large part of the year. So a highlight is that we did create that with the support of my agency director, that public health specialist position, as we were not able to successfully get nursing candidates or nurse positions filled. So we did hire 2 public health specialists in October. They started both on October 9th, as well as a contracted nurse who has former public health experience, who helped me to also, as a working manager and nurse, to help meet some of the vaccine immunization clinic requirements. So highlighting those successes. Also, on a positive note, for as far as the public health standpoint, the emergency order ended. So we were able to shift back to more of surveillance of communicable disease. Some of the reporting requirements were less on our health department. Moving forward in the document, you'll see that as far as COVID immunizations and COVID disease investigation follow-up, those sections, the numbers in 2022 are quite large in both areas. 2023 is drastically smaller because of the changes in reporting as far as the disease investigations. The immunizations themselves, the rules of that program changed where we could not offer that for free after a certain date. And we then had to transition to where COVID vaccines were being, people were being charged, their insurances were being charged for that. So we had to offer that to only the underinsured and uninsured populations. And there was not a great demand for that. So you'll see a large drop off in immunizations. And the majority of the immunizations we gave were the flu shots. So jumping into flu shots, one of our preparedness exercises is to operate a mass vaccine clinic every year. And we were able to successfully do so. We'd had flu vaccine ordered early in the year, anticipating we'd have staff to support that. And we were able to go into our Richland schools and vaccinate children with the flu vaccine. We also offered the flu vaccine to other clients at the agency. So we're really, really happy about that. We also completed a successful vaccine for children. VFC is the term we use in public health. We had an audit last year that's required every 2 years of public health. So that occurred in the summer, and that was a successful review. And pleased with the outcome of that, despite our small staff. And the other thing that is a success that wasn't captured in this, but I'll just highlight, and moving forward would be my goal is to emphasize the CHIP process that was published in 2023. And the 140 review process was started towards the end of the year, finalized in 24. Moving forward, my goal for the annual report would be to include the CHIP, the objectives, the interventions, the outcomes of that. I think that's important to note, especially as the annual report will go to the state as well for public health. Other areas to highlight. We provide TB skin testing services. That was brought up earlier. That's something we've done for a long time. It's not just for, it's an important function as it screens people for that disease, but we should also note that a lot of employers need that and require that for people to start work for certain entities. And it's what they do is they send people to the public health department for this service as they can't provide it themselves. So we were able to successfully continue that service throughout 2023 and actually gave a few more than we had in 2022. TB surveillance is also part of communicable disease. We were accessing what's called the Wisconsin TB dispensary last year. The state of Wisconsin provides services for folks that can't afford medications to treat tuberculosis infection or latent tuberculosis infection. There is a distinct difference in that tuberculosis, you are infectious, whereas latent TB infection, you are carrying the disease. You are infected, but you're not symptomatic and you're not currently infectious. So we have to treat people that have latent TB disease so that they don't develop tuberculosis symptoms and prevent that spread in the community. We did access the TB dispensary 4 times last year to provide meds to folks for that infection. Another part of communicable disease prevention is the rabies prevention and control program. This is where animal bites come into play, but most of the responses that public health follows up are your animal bite reports, which are generated by local law enforcement due to the laws surrounding that. However, we do get some cases every year of people that have like bats in their homes, and we provide recommendations and where they can take specimens to be tested. So we did respond to 67 cases, not of rabies disease, but for rabies control last year. So we did have 1 positive rabies specimen in the county last year that was not involved in any kind of exposure to a person. It was part of a collection of a sampling, a study. So we're grateful for that. The maternal child health program would be like home visits, nursing home visits to persons that are at risk. Often these are referrals generated from our local hospital or clinics, moms, families that have new babies that may need some support and services, and to help have a nursing visit to weigh the baby, to do an assessment, to just see how we can support and connect those families. We get referrals. Often those clients don't accept those referrals. So then sometimes they'll accept some phone interventions or some education by mail, but we do still try to get into the homes when we are allowed to do so. We do still manage the loan closet, which dispenses items for a small fee. And you can see in 2023, the loan closet rented out 324 items throughout the year. I'd like to highlight that public health staff, one of my former public health specialists, Rose Welsh, largely managed the inventory and kind of getting those numbers created and monitored, along with the admin staff who helps dispense that. Public health formerly was involved in the Richland Community Free Clinic and still tries to be to some extent. Again, with the staff turnover early last year, I was not able to be present weekly at the free clinic as the former health officer had been. So a decision was made that then we would have ADRC staff represent for a while. It's kind of in that transition. But I still do often communicate with the free clinic. We did offer vaccines specifically to the free clinic for flu shots in the fall. to help capture that Spanish-speaking population and get those folks vaccinated against the flu. You can see environmental health cases. You have numbers here listed. Again, Troy Morris was our environmental health coordinator up until the end of 2023. So he was largely involved in this work. Towards the end of the year, this was a planned change. So Troy was planning, Troy was part of a 5-county consortia. That consortia reduced to 3 counties. So Richland and Vernon were out of that at the end of last year. Grant County, I believe, was called the fiscal agent for that. Troy worked out of Grant County, but he would come to Richland County twice a month to respond to environmental health and largely home visits. But he also tracked the numbers of these specific environmental health complaints and contacts.
So Randy,
Yes, sir.
how are we replacing that? What are we doing?
Those duties are assumed by my unit now, by myself and the public health specialists that we have.
So I had several contacts with Troy over
I
the
see.
years. This was excellent.
Yes. And that's, yes, he is. And I'll say that, that was, it was disappointing to learn that we were one of the counties that wouldn't be continued in that consortia, but it was definitely not a decision that we really wanted, but we have a public health specialist now that was just recently hired who has former registered sanitarian experience and has done some environmental health work before. So I'm feeling hopeful about that moving forward. And then, yes.
Just to follow up on that, I think that's one of the most frequently complaints that I get from residents is you got to do something about so-and-so's junk pile that they've got on their farm. And Troy did what he could. There are certain constraints you can't, it's a free country, basically. But there are rules that you have to follow, so.
To speak to that, it is a challenging, one of the more challenging areas that we work in. There are specific things that constitute, as far as like what they fall under is specifically under our ordinance. And when we go in and assess, we're complaint driven. So we do have to respond to matters. Sometimes when we go into homes, it's not necessarily what we expect, or it might be worse than we expect. So it's a very, very challenging area. It's a lot of hard work, a lot of careful documentation to those responses. So. Also under environmental health would be included our childhood lead poisoning prevention. The numbers likely increased towards the end of 2023 as WIC clinics, WIC started running their clinic here again, and they collect lead samples, and we process and respond to elevated lead levels. So 131 Richland County children were screened for lead exposure, and then we had 12 elevated blood lead level results. So my understanding is that there was some slowdown of the WIC clinics and that testing during the pandemic era, during that emergency order time. So with WIC operating again, we've had more testing, that service is up and running again. So we're responding to a few more positive or elevated lead levels. And then we have certain requirements where if it meets a certain action level as far as like what the blood level is, then we will respond either by education, or sometimes it requires a home visit, and always coordinating and case managing with the physician and the family on that. And then as far as preparedness and response, we do largely partner with our local emergency management for emergency preparedness and response. And then we are part of the Schweiherk region, the South Central Wisconsin Healthcare Emergency Readiness Coalition. Again, the mass vaccine clinic constitutes our main preparedness exercise yearly. In former years, we had done some functional and tabletop exercises. And again, during the pandemic era, that was tested in real time. So I think we're pretty familiar with emergency preparedness and response as far as communicable disease control goes. I have nothing further to add at this time. Questions?
Yes.
I saw that you had to do a polio last year, polio immunization. Was that here in this county or was it any county? and why?
You're referring to an immunization, ma'am? We gave an immunization probably as part of a childhood vaccine series. Or it could have been for an unvaccinated adult. I don't have that specifically broke down here.
Okay, we didn't have anything positive.
No, ma'am.
It's more of a curiosity question, but I don't know a lot about lead poisoning, but isn't there a certain level of lead exposure where it's actually terminal? I mean, there's no cure for some lead stuff, right?
Yes, there are what you would call, so we have specific measurements. They reduce the threshold or the testing recommendations now where we would respond sooner to a lower level. It's like 3.5 deciliters per milligram. There are some critical values where chelation therapy would be indicated. Knock on wood, we haven't had something that high reported here. Some levels we do respond to because we're fearful that there's some exposure in the home. When we get to a level of 10, we will go into a home and assess. And then 20 requires some further action. So we do keep a close eye on those levels.
Thank you, appreciate it.
Yes.
Like Marty was saying about, junk on somebody's farm. What about like the villages in the city? Does the county take care of that, or does the village board or the town board take care?
So I believe I'm not certain. Go ahead.
So it depends. So certain municipalities within the county have their own public nuisance, public health ordinances. So for example, I think as the city, it would take care of its own, but it would reach out to public health because we're actually dealing with that right now with a gentleman. So a blend of both. I think it would ultimately end up coming down in cases of like hoarding and things like that. The remedy is for the municipality to go in and do the clean out on its own, and then we charge the cost of that as a special assessment against the property. So it would come down to who paid to actually do the clean out, and then that municipality would get that special assessment charge.
I was just wondering because there's stuff out there that
It's, as Brandy said, it's a difficult area, especially from an enforcement perspective, because it's a free country. So we have to prove basically an imminent threat to public health in order to warrant, intrusion into private property. So.
what about a lake that the public uses?
Dumping into a lake would be a different.
They're not dumping, it's just that it's sitting there, so I'm sure something is seeping into it.
And that might be more where we get involved and we make calls to the DNR or DATCAP in those agencies. There's some overlap.
Yeah, once you hit a public waterway, there's a whole other set of people who come in.
Okay. And I report this to you? Or who do I report that to?
Start with her, and then she reports it to me if it gets to that point.
Thank you.
Thank you, Brandy. All right, I think we do have an action on this because we're gonna send this forward to county board, correct? Or no, it says consent to submit to full county board.
I think it's, as long as everybody's okay, we'll just have it on the.
Okay.
Agenda.
I assume everyone is okay. All right. By the way, Dr. Barris, we're not ignoring you. So if you have any questions or comments.
No, I'm listening.
Okay. All right, so that takes us to 7E, the organizational chart.
So in your packet, you saw that the organizational chart was made as part of it. The only thing that I will note is the administrative and building operations and the business and financial services is now a combined unit of administrative and financial services. But the first page really is just an overview of all the employees in the agency, and then future pages have the very specifics of the different units. Did anybody have any questions or anything they wanted me to highlight in our org chart? This is something we typically provide on like a quarterly basis.
How many current vacancies are there?
2. What's that? Oh, knock on wood. Yeah.
Maybe the best it's been in
I think it is.
I don't know how long.
Yeah, and we're really hoping to make an offer on one of the open positions this week. We've done interviews and background check, or the reference checks. So hopefully by the end of this week, there'll just be one opening.
Yes. Okay. F, the HHS expenditures report.
The report is basically all of the bills that we paid for since we met last month. They've been approved by Candace and checks have been in the mail for a while for some of them, but if you have any questions?
So this is typically just a view. We don't make any action on this, but if anybody had questions. Otherwise, we'll move on to the 2024 HHS budget summary and Richland County placement report.
Don't know that I necessarily have anything to highlight. This is through the end of April. So we should be about 33% utilization of our budget, 7%, so not bad. We're doing good. Haven't had, if you go down, you'll notice also too, I kind of changed the format a little bit. It used to be lengthwise and I had placement reports, so I just kind of flipped it and you have a separate placement report now. I didn't think that reporting it twice made sense, so. Took the liberty of switching it around a little bit, but it's the same, it's exactly the same information. So we're at 27% utilization. If you kind of go down to the budget balance through April, you'll see only $16,882 in Winnebago mental health institution charges through April, so that's good. You'll see the anticipated revenue is pretty high, but that's because of delayed revenue coming in, right? We have our expenses through April, then I bill, I do all my claiming, and then it just takes a while for us to get our checks back. So that'll roll like that through the entire year. Then the charge back down at the bottom, not a lot to charge back. That's just the back and forth reimbursing our Fund 56 replacement funds. You can say we're sitting good at about 161,000 to the good right now, but you have to think that just letting you know that some of that includes the tax levy kind of sitting in our budget right now. So if I took the tax levy out, it would be closer to zero probably. So or below zero. So any questions on the budget? And then if we go on to the placement reports, the adult placements, Fund 54 is looking, it's only at 7% utilized. We've had quite a few placements in Winnebago this year, but a lot of it's been reimbursed by insurances. So that's good. And then if you go to children's, Fund 44, that's at 30%. So it's a little bit higher, but it's still under that 33% utilization. So no concerns right now, no high institutional costs and no secure detention costs yet as of this year. We did have a secure detention. Oh, okay, well that'll show up next month then.
We'll anticipate that going to say.
I didn't jinx it. It had already happened, right? And then, yeah, then you can see that. I know she spoke to all the different types of placements that we had. Treatment foster care costs quite a bit more than just a regular foster care, so that's why those are a little bit higher than we would like to see. But so, yeah. Any questions about our placements?
All right, thank you. So number 8 on our agenda is contract approvals.
So you will see that there are 4 total that we need approved. The first one, I'm just notifying you of that one. That is a contract that we entered into for ADRC services for some supportive home care with those National Family Caregiver Support Program dollars. If that's a contract under 10,000, it only needs to be approved by Candace, but I'm just notifying you guys of that one. But the first one that we will need approved by you is a new contract. It's with the Life and Harmony Music Therapy. This is a children's long-term support program contract. We have a family that moved from Vernon County to Richland, and this is a service that they had in place. And so to continue their services, we need to approve this contract.
Great. Do I have a motion to approve this contract?
I'll make a motion to approve.
Thank you, Sandy. Do I have a second? Michelle? Okay. Any discussion or questions? All those in favor of approving that contract with Life and Harmony Music Therapy, please say aye. Any opposed? Okay.
So our next three contracts are all amendments to current contracts we have. These are our CCS contracts. For each of these, individuals can pick who their provider is, and we have found that these three providers are taking a lot of clients on, and so we do need to increase these contracts. Just as a side note, these contracts will all move on board because they will be over the 50,000.
Okay.
And these are all reimbursable through Medicaid dollars.
Okay, so no tax levy involved in these. Any questions? Otherwise, I'll take a motion to approve all three of those together. Thank you,
So
Cindy.
moved.
Do I have a second?
I'll second.
Okay, any other discussion? All those in favor, please say aye.
Aye.
Any opposed? Great, thank you. Number 9, we have a resolution approving the utilization of opioid settlement funds to offer grants to the community to allow for the prevention, treatment, and/or recovery of opioid drug use.
So just over a year ago, Health and Human Services was tasked with taking the lead and getting a committee together to try to look at and determine what to do with the opioid settlement funds. We did have Southwest Wisconsin Regional Planning Commission complete a opioid settlement fund use assessment that was included in the packet. But the committee got together, I believe it was 5 different times over the past year. And through that process, we really looked at what are the needs of the community, how do we utilize these funds? And in the end, it was determined that the best utilization of the funds would be to offer grants to the community. And so you'll see this first document that is listed really kind of talks about the process, the outline, how it will look, what the funds are to be used for. And then the application is also in there. So part of the process would be that the committee would continue to remain intact, and they would review all the grant applications that are turned in. They would then submit recommendations to this committee, then would go on to full county board for their approval. Right now, we have about $141,000 of opioid settlement funds. So we would look to yet this year, hopefully have the first open period to have the grants, to offer grants to the community. And then the hope is twice a year to offer grants to the community. We would at HHS be the ones really overseeing the budgets of the grants, ensuring the compliance with the grants. That would be part of a process done at Health and Human Services. Does anybody have any questions? Yes.
So this is the reason I'm here. Who is on the opioid?
So who's on the committee? Ingrid comes, HHS staff, Sheriff's Department, the judge, community providers.
Yeah, that
and stakeholders, yes.
Okay, so the concern is if the community providers and community stakeholders represent organizations which may benefit from these grants, they cannot be involved in the process of evaluating them. And so my recommendation would be we either create an advisory subunit so that they can continue to participate in other aspects of it, or we simply have this committee evaluate the grants for recommendation to the full board. Otherwise, they, for their service on a much needed committee, may end up putting themselves in a position where they can be subject to up to felony charges. So we don't want them to have to go through that. You know, no good deed goes unpunished, but let's minimize the punishments.
I will say we did discuss this
Yes.
a bit, so that's why we needed
remember
your
reading.
official opinion on that, because this was an ongoing discussion.
Yeah, because there is a specific power assigned to them and they serve for a fixed term. They do count as public officials for the purposes of the code of ethics for local officials. And that prohibits them from having any stake in something with a financial impact that impacts them or an organization with which they're associated. We want them here because of the organizations that they're associated with, but unfortunately that precludes them from evaluating the grants.
So, okay, perfect.
So they're not able to abstain or,
No.
or do a conflict of
That was-
interest type of.
That was what we had landed on. I'm sorry to interrupt. Is that what we had landed on, that it was kind of advisory, and if they were a part of the grant that was being submitted, they would abstain? But you're saying that would not work.
You'd have to rotate out, and then the committee, you essentially have as many different committees as you had people that you had to conflict out, because you can't have a committee that is properly evaluating everything fairly if one of the members can't speak to it. So it would be, it's different at this level where there's an elected official. But given that these are appointed officials, really just serving in their capacity as experts in their field, but as members of the community, it would be safest for them, for us to simply take that responsibility away.
Okay, that was kind of what we had thought originally, but, so I assume then we would go back to just having it come straight here and inviting them to come and speak if they wanna say something,
That sounds good. So on the,
unless you had a different idea.
no, that's what I was thinking too. So on the second page of that, under application process, I will amend that to say applications can be submitted to the director. All applications will then be presented to this committee for their recommendation, or for their vote, and submit a final recommendation to full county board.
So I don't know, did that make sense to the rest of you? Okay. So do you have a question?
I'm conflicted. I'm currently a member of the Partners for Prevention Executive Committee there too. And I would think that especially for, to potentially apply for funding for an event, activity, or process of some sort that having to do with prevention. Yeah, how would that, I would just.
Oh, so she voted on it.
That's a good question.
It's a small community, we're all involved in everything.
That's where I get thinking.
Yeah, so you're on the executive board, but you do not in fact work.
Well, at
for
least
the-
until September. There are no, I'm not a paid, no, I'm a volunteer, it's totally volunteer. But it's a group, an organization I've been part of.
Well, you're not applying yet. Let me think on that, and I'll make sure that you're protected one way or another.
Because I'm thinking, I saw that, I thought initially, oh, National Night Out funding. It's a preventive community event that they're looking for some sustainability for once the grant process is going. It's a possibility. We're also looking at, although they are also looking at another organization to take it on, which would then leave me in the clear unless I exclusion have to join that one.
Right, a National Night Out 501c3.
Yeah, all of its own. So yeah, something to think about. It's too late for this year because it's in August, so.
One of the other caveats that I really want to point out with this is that if a county department is requesting funds, they do not have to wait for those twice a year. And so why we put that in there is certain grants need match, and there's only a certain time frame that we can apply for those grants. So we want to make sure that different county departments don't miss out on opportunities because it doesn't fall within the grant.
Okay, so hopefully that made sense. Are there any other questions? What we're looking for here then, and so if you can remember, she made some amendments to the actual draft itself of how we would go about getting applications. But what we are looking for then is a vote to approve the recommendation of the Opioid Settlement Funds Committee. Wait a minute, we're gonna have to amend that too.
Yes.
Okay. How would we state that then?
So you.
I'm looking at 9A, by the way, for everyone who's following along. So it would be a vote to approve the recommendation of this committee, correct?
Yes.
Yes, so
Okay,
it
so-
would just be an amendment to the resolution stating that the third whereas you can just remove from first,
Wait, now where are you reading from?
the actual resolution.
That's one I'm on. Which
Resolution
number is it?
approving The utilization.
9E? Okay, I was looking at the wrong one then. I'm sorry, everyone else. Go to 9E. All right. So which whereas?
So third whereas you take out the opioid settlement committee and recommendations
So will be accepted twice a year to be reviewed by the Community and Health Services Committee.
with final approval by the county board.
Okay,
And then in the
further result.
further results as well, same change.
Okay, so it will be accepted twice a year to be reviewed by the Community and Health Services Committee with final approval. Do we need to add in any language then about us making recommendations to the county board, or is that just kind of assumed? That would be assumed?
That's what
Okay.
the final approval would be.
Okay. Yes,
I just want you to know, I'm not trying to push to the end of the meeting, but my battery just went dead.
we are almost done, okay? This is like nearly the last thing. Okay, so if we're all on board here, is there anyone who'd like to make that motion to approve this resolution? Thank you, Michelle. Do I have a second? Mary, any other discussion or questions from anyone? This will go on to county board as well. So, okay, all those in favor, please say aye.
Aye.
Any opposed? Okay, so now we are on number 10, correspondence. Do we have any correspondence? No. Number 11, future agenda items.
So we would like the chip to be placed on the next
Yes.
meeting, and then a budget overview. And then our next meeting should also be our public hearing.
And we need to discuss the date.
Yes.
Okay, which,
So I have looked at options. If we want to do an evening meeting again, we could potentially do July 8th at 4:30.
July 8th at 4:30. Does that conflict with any county?
I asked Derek and he said we're good to go on that date.
I think it was, I guess not.
What day is that?
It's a Monday. Because our typical meeting date is on 4th of July.
Yes.
I will be from until July. I will not be available.
Okay. Does anyone else have conflicts with that particular date? Because I know you were checking room availability.
Yeah, so the times that I came up with, I did look at like July 3rd, so the day before the 4th at 9:30 if we were gonna do a morning, but I didn't know if we wanted to have it be the day before the 4th of July. Or July 8th at 9:30 if we wanted to stick with the morning meeting time.
That wouldn't help you.
Yeah.
What do you guys think about the July 3rd date? Do you prefer July 8th or July 3rd? Dr. Barris, any thoughts?
I would think the 8th would probably be better. I don't know if people have plans yet, but you know, those are always something that might come up later and may be difficult for people to attend on the 3rd.
Yeah, and actually, I'm just thinking we do traditionally offer this once a year in the evening. So if we want to keep that, okay. So we'll stick with that one and then, sorry, I mean, it's, everybody misses a meeting occasionally.
Well, is there no internet access?
Where I'm staying, very limited.
Well, because that is another option.
Yeah.
Wonders
Yeah,
if
it's
water-
very-
It's perfectly fine. I mean, for that matter, I'm going to be gone for the August meeting because I'll be on vacation. So it happens. I think it sounds like we should be able to make quorum. So, okay, all right, then we'll do that, July 8th at 4:30. Okay, adjournment. Want to make a motion? All right, do I have a second? Okay. Wow, you guys don't want to adjourn? Okay, all those in favor, say aye.
Aye.
All right, thank you all. I know that was a longer than normal meeting. I guess we're adjourned, but I just want to say again, thank you guys to the staff. I always appreciate that overview of our Health and Human Services Department because it just gives us a glimpse into the amazing amount of work. All right, have a good day, everybody.